Okay, thank you. Well, movement disorders like Parkinson's disease affect millions of Americans, and COVID took a toll on so many by limiting physical capabilities. Here to talk about the importance of movement is Dr. Joy Antonelle DeMarcaida, Medical Director of the Hartford Healthcare Chase Family Movement Disorders Center. Good afternoon. Thanks so much for joining us.
Thank you for the opportunity, Mackenzie.
Well, we want to begin with what are some of the conditions that potentially fall under movement disorders?
Thank you for asking that. So many people don't know what movement disorders neurologists see. Parkinson's disease is, of course, the most common that we would see, but we also see Tourette syndrome, gait disorders, tremors, dystonia, and tic disorders, Huntington chorea.
When we think about COVID, obviously so many were impacted, but how did it specifically impact patients with these movement disorders?
Most of our patients with movement disorders are older, and they have a neurodegenerative condition that affects their mobility most of all. So you can imagine that this pandemic that has affected all of us has impacted them most especially. They had become isolated. They were not seeing their families. They could not come up with the activities that they enjoyed, and they lost the benefits of exercising and socializing on a regular basis. Our team actually wrote a paper at the height of the pandemic talking about the impact of COVID on our patient population here in Connecticut. And truly, they are at high risk because of their comorbidities, because of their age. Many of them lived in skilled nursing facilities, so they really had to hunker down and be careful. And as we are all hearing this morning, that concern with the Delta variant is again going to impact our patients, so they really have to stay safe.
And when we talk about how much of an impact COVID had, also talking about your center, in-person classes had to be suspended. However, we have a little bit of good news. Tell us more about this.
That's right. As people started coming back to our clinics, Mackenzie, what we heard is how much they missed the exercise classes that we have in Hartford Healthcare at the Chase Family Movement Disorders Center. They felt they lost a lot of ground. They weren't exercising. They felt weaker. They were depressed from the isolation. And they actually even lost some cognitive benefits of exercise. So we are happy to say that despite what's going on, many of our patients are fully vaccinated. We have a safe space where you can come back to exercising so that you can regain those losses that you had. We are starting our classes in mid to late August. Patients of ours who are part of the classes will receive notification.
Perfect. And for those of you who may be interested, more information on those classes and the benefits of those classes, you can visit hartfordhealthcare.org/movement disorders. Dr. Joy, thank you so much for joining us.
Thank you, Mackenzie.